She said they're working very hard on it, their committees, and, there's going to be some strides made this year, and, things are looking up.
How did that make you feel?
Good.
Yeah?
Yes, I want to see everything yesterday, but that doesn't always happen. It's taken us years. I'm a retired state employee, and it's taken us years to get the kind of insurance we have now. And we went without raises to get it. So it's not going to be easy getting universal health care for everyone, but everyone should have it.
So why'd you come here today?
To speak to the legislators about health care, because it should be a right. Everyone should have good health care. That should be a right for everyone.
Actually, we're pretty psyched about supporting universal health care. Today we just got a chance to talk to Jack Thompson, and he's definitely supporting us. So we're here pushing and trying to make this happen. Connecticut needs a universal health care system that's working, that's going to work better than what we have right now. I've worked in the healthcare system now for about 12 to 13 years, and each and every one of my kids have been supported by the Huskies program. That'll carry them till they are about 17 years old, and after that, they're off. They're without insurance. I had to basically be in a position where my kids were off to college, and I had to either pay a parent's contribution or pay for their health care. And you already know which one won. My kids had to go to school, so they went without insurance. That shouldn't be, not in Connecticut. Not in Connecticut, We're one of the richest countries in the world. There's no way that we should have to struggle for healthcare system.
Where do you work?
I work at Sunrise Northeast, out in Andover.
As you know, you saw me just speaking with Representative Peggy Sears, and I did come I'm here personally and with everyone else for our universal health care. Now, where she stands on that, she gave me an undecided, and her decidedness is because of the price tag. And she's saying that though we may be spending she doesn't really believe it's the 22 million versus 18 that could be put out. And so my question to her is, what am I going to do, or what are we going to do when we get to a point, some of us at a point where we can handle this right now, but in a few years, our contract as retirees for the state is going to be canceled, or possibly canceled, or we're going to have to go for a new contract. So what am I supposed to do then? She says, well, Medicare is out there. Medicare? Is it working? Well, tell me now, what am I supposed to do if Medicare can't handle me? Am I supposed to choose between $600 worth of medical bills, et cetera, opposed to eating and keeping my house warm? And according to her, she's still undecided. But I did ask her about a few other things that we're here for: clean contracting, resolving the child care crisis, service for children and adults with autism. These were all yes, along with investing in our school program paraprofessionals. Basically, that's it. She was not opposed, but undecided on just the universal health care, which we know is something that we must have. We've got to have it if we are to continue to exist and everyone gets proper medical care. Why did I come today? Because, as I stated, I am a state retired employee belonging with the SEIU union. And I believe it's 2017, our contract is coming due. That's only 10 years away. 10 years come very quickly when you're older. And the way I'm looking at this 10 years is what's happened in 10 years when it does come, and I don't have anything to take care of me. What am I going to do then? Who do I go to? Have I saved enough money to pay a $150,000 hospital bill? I don't think so. If I go in a convalescent home and I need special care as far as extra medications and stuff, I know what they're saying. I don't have a family who have that much money that can keep me there. So I'm here today to get universal health care, not for just myself, but I believe that every single person is a person and that they need medical assistance regardless of how young they may be, how old they may be, and it's from my heart that God is saying this is something that needs to be done, not just for one person, yourself, but for everyone. Universal health care is an everything for everybody, everywhere, regardless of race, creed, of color, and we need this assistance.
Universal health care, fair insurance for everyone. That's the big thing. I have a decent plan, but 4 or 5 years ago I was paying $20. I'm paying $80 now, which seems to be nothing, but the prices is going up monthly, you know? It's just every day. We need affordable health care for everyone. It's not just for me, it's for, and I've been telling my daughter since she was 8 years old, you have until you're 25 years old because you have to have decent insurance. So with this, it's a way for her to get there and not stress. Every time we negotiate, the health insurance issue comes up and it takes away from me gaining money because it all has to go towards my health insurance plan. And it's a killer. Yep. I am waiting to talk. I've talked to Senator Harris, Senator Ken Green. I've talked to Eric Coleman, and I'm waiting for Representative McCormick, Doug McCormick. Now. Senator Harris was a little wishy-washy, but he was like, he's for the plan, but you have to think about it a little bit more. He has to read and get more in detail. Senator Green was very good. He was like, yes, it wasn't, he's an old friend too. I remember watching him play baseball back in the day. Representative McCory, I haven't talked to yet. Senator Coleman, he said he's on the plan. He's on the plan, so.
I came here in support of universal health care, so that's why I'm here today. Yes, it is. I'm excited. I'm excited to be here. Oh, I'm going to continue to do it.
Your Mark Liberty around.
I just spoke to my state representative, Jack Malone, from the 45th District about single-payer health care, the bill that's before the House of Representatives. Asked him to support that bill, and he said he's going to vote for it. And I told him thank you very much, we appreciate that.
First time you've been up here?
No, it's not. I make infrequent trips here. I'm a political activist, but I'm not necessarily a lobbyist. I just signed on to come today because the cause is very, very important. We can't afford not to have a better healthcare system here in the state of Connecticut and across this nation, by the way. So that's why I'm here.
Yes, I'm interested in down here for the universal health plan because I work for Oak Hill School too and been there for 20 some odd years, almost 25 years now, and that every time, like one of the ones was saying, every time we have go through negotiation, that's the first issue that comes about, health plan. And then I have raised my kids though, but one thing about it, I had to work 2 jobs to do that and get in health insurance for them. So I'm here really trying for my grandkids and all the people that we can get affordable health insurance for them so that they can go on and live a beautiful life in the state of Connecticut. They don't have to leave here.
Who have you talked to today?
I've just finished speaking with Jack Thompson. Yeah, and I'm waiting to speak, and Ken Green also, and I'm waiting now to speak to Randy Barry and Christopher Stone.
How did it go with
Thompson? Oh, he said yes. He said he's an old timer. He said that he's right on and good for universal health care. He was right, so he said yes, and Ken Green said yes too.